new cases of COVID-19 in Ontario. There are 279 people in hospital and 149 in the intensive care unit due to COVID-related critical illness. And I'm sorry to say that there have been another 6 deaths that have been reported. Our vaccination rate continues to climb. Currently, 86.7% of eligible Ontarians have 1 dose and 81.8% have 2 doses of a COVID-19 vaccine. A total of 37,057 tests were processed yesterday with a positivity rate of 1.7%. We're moving closer to our target of 90% of eligible Ontarians vaccinated, which will help to slow the transmission of the Delta variant. Thanksgiving is coming up, a special time of year for many Ontarians, and an opportunity to show appreciation and gratitude. I am only too aware of the negative impacts and the social isolation can have and the need to spend time with our loved ones. That is why we want families to embrace the opportunity to get together for their mental, physical, and social well-being. Last year, Thanksgiving looked very different for many of us. In-person celebrations were limited to immediate households, and virtual celebrations became more common. But thanks to our collective efforts to get vaccinated and to follow public health guidance, we are able to gather together with friends and family to celebrate Thanksgiving this year, provided public health measures are followed. Pour beaucoup parmi nous, le jour de l'Action de grâce était un peu différent l'année dernière. Les célébrations en personne étaient réservées aux membres du ménage immédiat et les célébrations virtuelles sont devenues beaucoup plus communes. Mais grâce aux efforts collectifs des Ontariennes et des Ontariens qui se sont fait vacciner et ont suivi les conseils de santé publique, nous sommes en mesure de nous rassembler avec notre famille et nos amis pour célébrer l'Action de grâce cette année d'abord que toutes les mesures de santé publique sont suivies. If you choose to host an in-person social gathering this year, remember that under Step 3 of the roadmap to reopen, you can have up to 25 people indoors and 100 people outdoors. But the fewer people who gather, the lower the risk of transmission. And outdoor gatherings are always safer, so use outdoor spaces whenever possible. When gathering outdoors with a group of fully vaccinated individuals, no face covering or physical distancing is necessary. But if you are gathering outdoors with people from multiple households who are unvaccinated or partially vaccinated, or their vaccination status is unknown, please consider wearing a face covering if physical distancing cannot be maintained. And when gathering indoors with a group of fully vaccinated individuals, you could consider removing your face covering if everyone is comfortable. But if you gather indoors with people from multiple households who are unvaccinated or partially vaccinated, or you don't know whether they've been vaccinated, you should wear a face covering and physically distancing. Et lorsque vous vous rassemblez à l'intérieur avec un groupe de personnes entièrement vaccinées, il est possible pour vous d'enlever votre couvre-visage si tout le monde sont d'accord. Mais si vous vous rassemblez à l'intérieur avec des gens venant de multiples ménages qui sont non vaccinés, partiellement vaccinés ou dont le statut de vaccination est inconnu, vous devriez porter un couvre-visage et garder vos distances. Regardless of setting, you can wear a face covering and physically distance if you feel it is right for you, especially if you or others are immune compromised or at high risk of severe disease or exposure to COVID-19. No one should attend a Thanksgiving or other social gathering if they are sick. Even if people have mild symptoms, please stay home and get tested. Make your event as safe as possible. You should also provide hand sanitizer, soap and water for your guests to wash their hands frequently, cover your coughs or sneezes if possible, keep the windows open to increase ventilation, and ensure high-touch surfaces are cleaned and disinfected. Halloween is also around the corner, and I know our kids are eager to fill up their bags and pillowcases with candy. So I did want to share a few measures that people should consider as they prepare for Halloween. Trick or treating should take place outdoors as much as possible. Be creative. Fashion a face covering into your Halloween costume design. But remember, a costume mask is no substitute for a proper face covering. Do not overcrowd the doorsteps. Take turns and keep interactions brief. Maintain physical distancing as much as possible. L'Halloween arrive bientôt et je sais que nos enfants ont bien hâte de remplir leur sac et leur tête d'oreiller de bonbons. C'est donc pourquoi j'ai quelques mesures à partager avec vous que les gens devraient prendre en considération dans leurs préparatifs d'Halloween. Passer les bonbons d'Halloween devrait se faire à l'extérieur le plus possible. Faites preuve de créativité. Intégrez un couvre-visage à votre costume d'Halloween, mais attention, le masque de votre costume ne remplace pas un couvre-visage en bonne et due forme. Ne soyez pas trop nombreux à la porte. Prenez votre tour et ne vous attardez pas. And for the slightly older trick-or-treaters who might be considering attending or throwing a Halloween party, all the guidance that I had previously outlined for Thanksgiving and other social gatherings applies to you too. And it bears repeating, if you are sick, even with mild symptoms, you should not be participating in social events like Halloween. We know from experience it is exactly these kinds of events that can lead to spikes in transmission. But provided we do our best to follow the guidelines in place, we can enjoy some well-deserved time with friends and family while also keeping our community transmission low. I also wanted to address different kinds of events, and today it's about weddings. We have noticed a number of outbreaks associated with weddings, in particular wedding receptions. I know that getting married is a special moment for couples and their families, and that no one wants COVID-19 as one of the guests. It's imperative that public health measures are followed to ensure the health and safety of the happy couple and their friends and families. Also note that while the current regulation states individuals who are not fully vaccinated attending a wedding reception in a meeting or event space can provide proof of a negative COVID-19 test in order to attend, this exemption expires on Tuesday. This means that as of Wednesday, October 13th, proof of vaccination or an eligible exemption will be required. Il est à noter aussi que présentement, les gens qui sont invités à une réception de noces n'ont qu'à montrer la preuve d'un test négatif pour la COVID-19 pour pouvoir y assister, mais cette exemption prend fin mardi. Cela signifie qu'à partir de mercredi, le 13 octobre, la preuve de vaccination ou d'une exemption admissible sera nécessaire. I know that we continue to call on Ontarians to make sacrifices, to change habits, and to be vigilant. And the last 20 months have been challenging and stressful at times, even distressing. I sincerely hope that you are able to spend time with loved ones this weekend, whether in person or virtually, and to relax, reflect, and give thanks. And if you haven't already, please take the time to get vaccinated this weekend. This Thanksgiving, a vax-giving. And as we head into this Thanksgiving weekend, I want to take a moment to express my gratitude and my thanks to all of you. Et alors que débutera la fin de semaine de l'Action de grâce, je saisis l'occasion de vous exprimer à tous ma gratitude et mes remerciements. I am extremely proud and thankful for your continued efforts to mitigate the spread of COVID-19 in Ontario. And thanks to you, we are managing to keep the fourth wave under control. Thank you. Merci. And with that, I'll just make one additional comment. Today, we have released further information about our third dose strategy in Ontario. We have released a guideline with a list of immune-compromising medications that will make individuals taking these medications eligible for the third dose. And also, we're expanding to all retirement homes and elderly congregate living settings, not just long-term care facilities, those living in those institutions and areas, the ability to get their third dose. Updated guidelines are on the ontario.ca website as we speak, and we'll be implementing this with our public health, retirement home, primary care partners, and pharmacists over the coming days. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Allison Jones with the Canadian Press. Please go ahead.
Oh, hi, Dr. Moore. I just wanted to ask about Halloween to start. I noticed that one of the bullet points in the guidance is for kids not to sing or shout for their treats when trick-or-treating. Just curious how you envision that going. Kids generally go to the doors and shout trick-or-treat. Should they just not be speaking at all?
Oh, no, I mean, they'll have masks on. It's just not to yell too exuberantly. I think the purpose of that comment was not to aerosolize, and it's just a risk reduction strategy. Clearly, you have to make your presence known to get your treat, and you have to be able to knock as well as ask for the treat. We just ask not with a high volume that could potentially aerosolize. It's an abundance of caution, and last year when Halloween was present in Kingston and I was giving out candies, kids were great, and the event went smoothly without any issues, and the children were all reasonable and lined up appropriately. So I certainly hope across Ontario it goes well again this year.
Follow-up?
Thanks. On another topic, we're starting to see workers in hospitals and long-term care homes lose their jobs over the mandatory COVID-19 vaccination policies. Likely we'll see even more of that over the next few months. Are you worried about the impact that these staffing shortages could have in the middle of a pandemic?
With any policy, we absolutely worry about unintended consequences of any policy. And certainly we're watching that situation closely. We've watched where it's been fully implemented across the health sector in Quebec and in British Columbia. I'm saddened that individuals won't get immunized. I think as a healthcare worker, anywhere you're working in a high-risk environment, whether it's long-term care, acute care, it's your personal obligation to be vaccinated to protect the patients you serve and you provide care for. And I believe strongly in that. And I'm happy to say the vast majority of healthcare workers have come forward because they feel obligated to protect them, their families, and friends as well. There are a small percentage that aren't, and I'm very saddened that the potential of losing their jobs coming forward. It is absolutely not our intent. Our intent through these policies are that they embrace the opportunity to be immunized, to protect themselves, to protect their families, to protect the patients that they are honored to care and serve. And that is our an entire wish is that they become immunized. These vaccines are safe. They are exceptionally effective at minimizing individuals' risk to get the symptoms of COVID-19 as well as the risk to get hospitalized in the intensive care unit. A major reason why these vaccines are important for healthcare workers as well is that healthcare workers are essential, and to have anyone off because they've been exposed or because they've gotten the infection takes time away from care and has negative impacts as well. So all of these policies, they need balance. I am saddened that some workers haven't come forward to be immunized, but in some settings, it's absolutely essential that they be immunized. And we must learn from the long-term care sector the deaths that have occurred there and further prevent illness.
Next question.
Your next question comes from Lorenda Redikoff with CBC. Please go ahead.
Hi there, Dr. Moore. Many doctors are still refusing to see people in person and not sending patients to the ER. What's your reaction to what's happening, and what is your advice to doctors? And finally, have they been sent directives on this?
So great question. We haven't sent directives. I have sent a letter in partnership with the College of Physicians and Surgeons Ontario, in particular regarding frontline healthcare workers, primary care workers in particular, being able to see patients in person. I do think we need a balance between the percentage of patients we see virtually and that we see in person. There's so many nuances to an interaction when you see someone in person that is lost during virtual care, and certainly for the provision of vaccines, for basic cancer screening such as pap smears. All of that needs to get done in person, and we don't need further delays in the provision of the basic vaccines and or basic cancer screening or physical examinations that need to take place. So it does need to be balanced. I do strongly encourage our primary care partners to have a balance within their practices, and we're monitoring through billing that proportion that's occurring, and hopefully we're going to see an increase given that the vast majority of our population who's eligible has been immunized, and given that we have very good infection prevention control practices in primary care settings. It's certainly my hope that more physicians are providing direct in-person care. I think that's essential for the health of Ontarians and for the patient-physician relationship. And essential screening. So there's no directive that's been written, but it's certainly encouraged by our office in partnership with the college. The impact on emergency departments, we monitor emergency department visit volume in almost real time, and the emerge volumes are right back at around 20,000 visits a day across Ontario, which is a high volume, high impact, and they're probably very much at their maximum right now in emergency medicine. So the more the system works cohesively and collectively, the better off we'll be able to serve our patients and minimize the impact on emergency departments and the acute care sector.
Follow-up?
We've been seeing Ontario's case numbers and hospitalizations dip while it's a much different situation in other provinces. What do you attribute the drop here in Ontario, and how much do you see as connected to lockdown measures and restrictions here?
Thank you for that question as well. And as it's Thanksgiving, I have to thank Ontarians for having been wonderful in prevention. I do think it's a balance between having high immunization rates and adhering to just the basic public health measures. And Ontarians deserve thanks and simply praise, as certainly from me, because we're able to keep our rates of illness low, some of the lowest in North America as a number of cases per 100,000. So we're at roughly 86 percent of our population, over 86% of our population has had their first doses who are eligible, and we're adhering to masking, we're adhering to distancing, we're practicing good hand hygiene, we're screening now if you're going to a family setting, whether the person's been vaccinated, whether you have symptoms, and we're all adhering to precaution and prevention, and that's keeping Ontarians safe. And all I can say is thank you, keep doing what you're doing, it's working. I do think that the certification process that we're putting in play to make going indoors safer for restaurants and for high-risk venues like mass gatherings at a sports game is also going to keep Ontarians safe in the long term. We've got a long fall and winter ahead of us. The weather is changing, the leaves are changing, and we must keep this momentum up. But from me on Thanksgiving weekend coming up, my heartfelt thanks. Ontarians are doing the right things, and it's the proof is in the pudding. Our counts are reasonable, and our impact on our hospital partners, our hardworking nurses, respiratory techs, physicians, ambulance, is having an impact in allowing them to provide and restore some of the healthcare services that we haven't been able to provide in the last year and a half. So thank you, thank you, thank you. Keep doing what you're doing, Ontarians. We're heading in the right direction.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Dr. Moore, I'd like you to look back to a year ago and where you were both as medical officer for Kingston, but also where the province was. A year ago, you were advocating for people to have just stay within your own family unit, within your own household, have virtual celebrations. This year, it's a bit more loose, but we actually have more people in hospital than we did a year ago. We've got similar case counts. What's the difference between now and then in terms of how the province and public health authorities are reacting?
I think an 86.7% immunization rate in Ontario is what's allowing that to happen. I think one of the first questions as you move indoors for a Thanksgiving event should be, is everyone here vaccinated? If they're vaccinated, the next question you should be asking, have you got any symptoms compatible with COVID-19? If you have fever, cough, flu-like symptoms, muscle aches, joint aches, you should not attend. And then you can proceed indoors with good hand hygiene, distancing, masking if you so choose, if you're vulnerable to this virus, like immune suppressed. So we've learned in the last year and a half how to minimize the risk of COVID-19. And that took us a year and a half to build all of that knowledge base up. And now, in addition, those are ingrained in our behaviors. But now, in addition, we have a high level of protection through very safe and effective vaccines, which is enabling us. And I'm so thankful that we can have in-person Thanksgiving going forward. And I think it will be safe. And I think Ontarians will follow the rules and will prevent further transmission over this long weekend because we've been good at applying these basic principles. And we've learned them over the year and a half. And now they've become part of our normal functioning to ask these questions, even in a family setting, and to apply them. And a change in behavior and maintaining that behavior will only keep us safer as we head to further celebrations. So looking forward to Christmas and to New Year's, and having them occur safely in Ontario as well. So great question. I applaud Ontarians why we can do this more safely now with the addition of the protection of safe and effective vaccines.
Follow-up?
So on that note, we've got, as you said, just almost 87% first dose, almost 82% second dose. We've got the vaccine passport certificates, whatever you want to call them, in place. A lot of small businesses, in particular in the hospitality sector, restaurants, bars, and so on, are saying, look, patio season is either over, depending on where you are in the province, or about to be over. Shouldn't we be able to increase capacity limits given restrictions that you have to be fully vaccinated to enter these establishments? We've got the passport system in place. Why can we have, I was at a Jays game last week with 29,000 of my closest friends. The Senators and Leafs are playing this weekend in Toronto with nearly 10,000 people indoors. Why should a restaurant that is normally at about 50 people pre-COVID be reduced to 25 or less in the current situation? Are you looking at increasing capacity?
Yeah, so we're following the data, as you know, on a daily basis and looking at removing public health measures over time that make sense, that remain safe, because we don't want to step backwards. We only want to step forwards. And public health measures are reviewed regularly, whether they need to be kept, whether they should be following a risk-based approach, whether we should be anticipating a rise over the next couple of weeks of increase in cases. I certainly hope not. I do trust Ontarians to do the right things this weekend. They've proven after the September long weekend that we didn't have a significant rise in cases. But I want to assure businesses we look at this data on a regular basis and that the government is only holding public health measures if necessary. Yes, we've been slow and cautious and conservative in Ontario, but it has worked for us, and we only want to move in one direction. So please bear with us as we monitor the data going forward. But I assure you these issues are discussed regularly of how and when we can safely open up. And I think we've done so safely and cautiously and will continue to do so, monitoring the data.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. On Tuesday, you were speaking of that perhaps we need a review of vaccine exemptions because you were saying anecdotally you were hearing they might be on the high side considering how many people statistically have these conditions that qualify for an exemption. So what did you have in mind there? How would it be carried out? Do we need a better system to keep an eye on this?
So the certification validation process is a process that is to best protect Ontarians. There will always be some medical exemptions that will be accepted. That's at a frequency that's relatively known given the incidences that occur. From a population vantage point, we trust most Ontarians to adhere to these rules. We trust the medical and nursing professionals that are filling out these forms to do their best to fill it out. It's proving to be safe as we move indoors. We haven't seen significant outbreaks where we've got the validation and certification process in place. So from my vantage point, the system's working. Yes, there may be, it's brought constantly back to us about the risk of fraud, the risk of medical exemption. But from my vantage point, the system is working. The vast majority of Ontarians are following the rules. The vast majority of businesses are, and I think our numbers are showing that as this slow and steady decline in risk. I also just have to thank our local public health colleagues who have been excellent at case and contact management, who have been keeping the risk low in our communities because our communities are coming forward. If they have symptoms, they're getting tested, and public health is supporting those individuals that are positive with very rapid case and contact management, and that together with high immunization rates is keeping us safe, as well as these validation and certification processes.
Follow-up?
Yes, thanks, Doctor. And just to follow up on that, there's been a fair amount of controversy this week about 2 of 70 MPPs in one party caucus at Queen's Park with exemptions, which is, statistically very high. And I'm wondering if you're worried that this sets a bad example, or if it raises concerns in your mind about those exemptions, because it is, that is a high rate, 1 in 35.
No, I have no concerns at present. I just have to applaud the legislature from having an immunization policy. I had to show my immunization to come in here with my driver's license. The process is working. The vast majority of individuals in this building would be immunized and or have an exemption. That is what we want our businesses to be able to adopt to keep these closed spaces and environments safe. So have to applaud them for having the policy in the first place. The statistical risk remains exceptionally low. People still, if they have an exemption, would be monitoring for symptoms of COVID-19. They would get tested if they have symptoms. And so no system's fail-proof, but we have the backups for protecting our communities as we go indoors and we go into different venues. And from my vantage point, generally across Ontario, the system is working.
Last question.
Your final question comes from Julianne Lamoureux with Radio Canada. Please go ahead.
Oui, bonjour, Dr. Moore. J'aimerais savoir, avez-vous peur à une recrudescence du nombre de cas dans une dizaine de jours à la suite des rassemblements de la fin de semaine?
Je ne pense pas que j'ai compris toute la question à cause de...
I can ask it in English, and you can see if you're comfortable answering in French. I was asking if you were afraid of a rise in the number of cases in 10 days or 12 days after the gatherings this weekend.
Ah oui, après chaque fin de semaine, spécialement les festivals ou les fins de semaine comme l'Action de grâce, on va chaque jour suivre le data et d'être certain qu'il n'y a pas une grande implémentation des cas.
Follow-up?
No.
Quebec is keeping track of how many healthcare workers remain unvaccinated in the province. Is Ontario doing the same? And if so, do you have the number? And again, if you're comfortable, please answer in French.
Okay, so ça va être en anglais malheureusement, mais for long-term care, I do believe they've made the data publicly available on the ministry website, and so they wanted to be transparent and accountable, and they've set the set date of when a worker must be immunized by, and I think that's November 15th. For acute care, that's each hospital would have that data. I don't believe it's aggregated yet. But for the long-term care, they've been quite accountable and transparent with those numbers. The Ontario Hospital Association may have the data specific to each hospital corporation in Ontario. Generally speaking, though, in the acute care sector, the numbers are in the mid to high 80s. Certainly we'd like to see it higher, but that number seems to be increasing day by day.
Thanks, everyone.